Is lactose intolerance common in babies? Have you ever wondered if babies can be lactose intolerant? It's a question that many new parents ask. Let's break it down. Lactose intolerance in babies is generally uncommon. Most full-term infants are born with enough lactase, the enzyme that helps digest lactose. Lactose is the main sugar found in breast milk and formula. This means that typical infants can digest lactose without any issues during their early months. Lactose intolerance usually starts to show up later in childhood, often after the age of 3. In some cases, premature babies might experience a temporary form of lactose intolerance known as developmental lactase deficiency. This happens because their intestines may not produce enough lactase yet. However, this condition usually resolves shortly after birth. Most premature infants can still handle lactose in breast milk or formula once their digestive systems mature. Now, let's talk about primary lactose intolerance. This is the common form that occurs in adults when lactase production decreases after weaning. It is very rare in infants and typically does not show any symptoms before about 5 years of age. If lactose intolerance symptoms do appear in young children, they are often due to other gut conditions like infections or cow's milk enteropathy. These secondary causes are usually temporary and improve as the underlying issue resolves. It's also important to differentiate lactose intolerance from cow's milk allergy. Cow's milk allergy is an immune reaction and requires different management. Most infants with this allergy can still tolerate lactose unless they have intestinal damage that leads to secondary lactase deficiency. From a nutritional standpoint, since lactose intolerance is uncommon in babies, lactose-containing foods like breast milk and standard formulas are excellent sources of nutrition. If you suspect lactose intolerance in an infant, a careful evaluation is essential. This helps identify the cause and avoid unnecessary dietary restrictions that could affect growth and development. In summary, lactose intolerance is not common in babies, especially those born full-term. It is more likely to develop later in childhood or result from other intestinal issues rather than being a primary problem in infancy. Premature infants may have a transient form but usually outgrow it quickly. Understanding these facts can help ensure proper feeding practices and avoid confusion with other conditions like cow's milk allergy.